All right, this is JC Sinelli again from Camporee District, and I have the pleasure to welcome at this time to our camporee Captain John Rotruck of the United States Naval Ship Mercy. Welcome, Captain Rotruck.
Thank you for having me.
So I'm sure some of our scouts may have seen the Mercy come into Los Angeles. You've been in the news a lot recently. Before we talk about that, can you tell us a little bit about the ship itself?
Sure. So we're a 1,000-bed hospital ship that includes 12 operating rooms. We have the full breadth of medical and surgical capability on board. So we have intensive care units, ward beds as well. We can do all kinds of surgeries. The ship itself is actually the second biggest ship in the U.S. Navy, second only in size to a super carrier. So we're able to essentially transport that 1,000-bed hospital anywhere in the world, whether we're anchored out somewhere or we tie up pierside. In many parts of the world, you can imagine that a 1,000-bed hospital run by the United States is the largest and most capable hospital present in any direction for hundreds or even thousands of miles.
So I did a little research, and it looks like the Mercy actually started life out as an oil tanker. Is that correct?
That's correct. So the Mercy was a San Clemente class oil tanker, as was its sister ship, the Comfort. The U.S. Navy purchased both the hulls themselves, the tankers, and the conversion process from NASCO here in San Diego. And the conversion for both ships took place here in San Diego. Construction on the Mercy started in 1985 and was completed in 1986. And the Mercy was the first of the two ships that completed the transition. So therefore, it is the Mercy class of hospital ships, numbers 19 and 20.
Ah, that makes sense. So I had a scout from Trumbull, Thomas from Trumbull asked, how many hospital beds do you have on the ship itself?
Sure. So once again, it's 1,000 beds total, and 88 of those are intensive care unit beds. The rest are ward beds. And of the remaining beds, 460 are actually second-story bunk beds. So as you can imagine, those are very good for transporting, say, displaced persons from a humanitarian crisis, people with behavioral health issues or non-combat injuries. But those will be a little more challenging to use in the setting of people that have sustained significant combat injuries. So not all beds are quite the same flavor on the ship.
Gotcha. And we had a Nick from Trumbull also ask how many operating rooms there were on the ship.
There are a total of 12. They're all quite large, actually, by civilian hospital standards, with the idea being that if we were taking care of combat casualties, we might have to have several different kinds of surgeons operating on the same patient at the same time. So in other words, we could have orthopedists working on the limbs, we could have general surgeons and thoracic surgeons, kind of working here in the center of the chest and the abdomen all at the same time. And one of our 12 operating rooms actually doubles as what we call a hybrid operating room, which essentially has interventional radiology capabilities, so very, very big fluoroscopes in the room so that we can do procedures under fluoroscopy, but in the sterile environment of an operating room.
We have a scout, Joseph, who asked how many doctors and nurses are there on the ship?
So the full crew for the ship of military folks is up to 1,200. Roughly 2/3 of those are medical and the other third is non-medical. So as you can imagine, it takes a lot of non-medical people to run a hospital. So we have culinary specialists, information technology folks, retail specialists, machinist mates who make our oxygen for us. We're one of only two types of ship in the Navy that can make their own oxygen. So we have a lot of people who are not medical but are required to effectively support the running of the hospital. So essentially everybody on the ship who wears a uniform reports to me as the commanding officer of the medical treatment facility, whether they're medical or non-medical. And then the ship has a complement of civilian mariners who actually run the ship, run the engine, drive the ship, navigate it, and do all the line handling and deck functions. There are typically 37 of them when we're here in San Diego just sitting pierside, and we're out on a mission that number about doubles.
Okay. There is a scout, Frankie from Milford, who asked, has there ever been an experience that affected or changed you the most as a doctor?
Goodness. think I can speak to that. So for anybody who doesn't know, I'm an anesthesiologist by training. Um, so I was providing care for one of our wounded warriors in the operating room at Bethesda, and that individual had what we call an aspiration event. In other words, they wound up vomiting at the time that we were trying to secure their airway with a breathing tube, and that can be quite catastrophic for someone. So even though we reacted immediately and did the things that you're supposed to do to basically salvage that situation, we did get the breathing tube in and so forth as we had intended. Ultimately, the long-term effects of that wound up being part of the reason why this individual passed away about a month later. And I've definitely carried that with me ever since. I mean, as you can imagine, it's both gratifying and also very challenging to take care of some of our combat injured warriors, particularly when you look at the extent of the injuries that they've suffered in the service of the nation. And of course, you always want to do your best for everyone, including that group in particular. It was definitely a struggle that we didn't do anything wrong, but ultimately we weren't able to provide the long-term life-saving care that we wanted to for this individual.
Sure, I'm sure that's something it's got to be difficult when we're often making life and death decisions as part of your job. The thing I want to talk to you about now is I noticed that you're wearing a Scout uniform, not a Navy uniform. You are an Eagle Scout, and can you tell us a little bit about your scouting history?
Sure. So I did all my scouting in Central Florida as a youth. I'd never been a Cub Scout, so my family moved to Central Florida when I was a Boy Scout age. So I don't think I had an unusual experience necessarily. I was at the troop that met at the church that my family attended. I think Central Florida is a great place to grow up. Obviously the weather is very conducive to year-round scouting. I can't say that I ever did snow skiing or anything like that as a scout, but certainly plenty of other outdoor stuff. And just I was in a great district and a great council with a lot of activities and opportunities. Certainly doing district camporees or council-wide camporees were very big and very fun events to participate in, and ultimately to hopefully provide some leadership to at some point. I did have the chance to go to a World Scout Jamboree as a youth member. So the 1987-88 World Jamboree in Australia that happened more or less right after Christmas of 1987. That was a tremendous experience to see what scouting around the world was like. As much as we think we've sort of cracked the code and mastered it in its entirety here in the U.S., it's certainly incredibly powerful in so many countries. And I don't think I appreciated it as much as a youth attending the World Jamboree, but the most recent World Jamboree here in America, where I was able to serve on the medical staff, just seeing a lot of countries that don't necessarily get along all that well with each other from a diplomatic perspective and a leadership of the country perspective. The kids in those countries did fine. Nobody needed to either tell them to get along or anything. It just happened. It's just the magic of scouting that happens.
Yeah, I was at the last National Jamboree, and I saw the same thing with the international scouts that were there. It's a pretty amazing experience. Do you have any particular moments or memories that stick out to you as a youth in scouting?
I mean, certainly the World Jamboree would be one of them, and then my chances to attend National Order of the Arrow conferences again. Tremendous events with a lot of moving parts that sort of blow your mind when you're a youth member of the organization. But I think ultimately, those events inspire us as well to go back to wherever we're from and continue working hard, continue to generate a positive program for everyone in our local area. So I'm thankful for the opportunity to have participated in those, and again, kind of get fired up and go back home and hopefully make the world a better place.
So you mentioned the Order of the Arrow. I had the pleasure working with you at a couple of the most recent National Order of the Arrow conferences, and I know you've been active since a youth. You were a honor member of the Order of the Arrow, and you're also a recipient of the Distinguished Service Award. Tell us how your experience with the OA has helped shape you in your life personally and in your career.
Sure. So I think the OA is a great opportunity for older scouts really, I guess, lead, to put it as simply as I possibly can. When you think about the skill set that's required to plan a section conclave, for example, um, all the moving parts involved with that, particularly, delegating out and trusting that people are doing what they're supposed to do, but verifying at the same time. Those are the exact same leadership traits I use on a day-to-day basis in running the medical treatment facility on U.S.N.S. Mercy. So I think all those things that we get to do as scouts and as airmen have a direct translation to being successful in whatever professional life we choose to pursue.
Okay. You also have been involved with the National Committee of the Order of the Arrow. Has that experience? How is that experience versus working with let's say, the United States Navy?
Well, obviously, in a setting like the National Order of the Arrow Committee, you have a lot of folks, a lot of different backgrounds present. And I think, hearing how other people think, particularly people who have been on the committee for a long time, how they approach problems and the sorts of questions that they ask when an issue or a concern comes up, I think is very instructive for me, and I think probably very instructive for other newer members of the committee. It's just a different way of approaching things than perhaps I might have otherwise considered. And I think whenever we're in that environment, whether it's in scouting or in our professional lives, you have the chance to hear, I'll call more senior, more seasoned folks kind of dissect a problem and ask questions about it. I think you naturally learn from that, so that when you eventually become the more senior person in the room, you've been able to absorb all of that and hopefully put it to good use.
Absolutely, and I like the word seasoned. As I've gotten older, I like the word seasoned better than senior. Let's talk about your most recent mission. As I alluded to in the beginning, you were asked to go to Los Angeles. I actually want to share a screen of a quick video of your ship coming in. For the folks watching, this is a video of the Mercy coming into Los Angeles. Now, you guys have left LA. You've gone back to San Diego. Is that right?
That's correct.
So tell us a little bit about the time that you were in Los Angeles. What was the mission there?
Sure. So our fundamental reason for being there was to act as a relief valve for local hospitals, so that we could take hospital transfers of non-COVID infected patients, essentially to generate additional capacity within the local hospitals to be able to direct their time and resources to taking care of COVID patients. But even more simply, we were taking care of the non-COVID folks so they could take care of the COVID folks. And we got there fairly early on in terms of the progress of the pandemic there in Los Angeles. So we were able to establish the systems that we needed to have and the processes that we needed to have to take patients and transfer. We were able to do that very effectively, and not only take patients, but then provide for their acute hospital needs and then get them discharged either to a nursing facility or to home, or to help them find placement if they were homeless when they started. So that's very important in terms of generating throughput at a hospital. You have to be able to discharge people as well as bring them on board, otherwise you just wind up filling up. So we were able to continue to regenerate our own capacity to take more patients from LA as we went. And I think we were extremely successful at our mission. We had great partners at the local hospitals and also the county of LA and the state of California. They already had a pre-existing system in place for inter-hospital transfers called the Medical Alert Center. So we just had uniformed service members fall into that and essentially act as our representatives within that center. So we essentially were just another hospital in the LA area for hospitals to transfer to, just as if the way that their system normally runs. We didn't develop anything new for that.
So I saw on some of the news coverage that you actually had some crewmen that came down with the virus. Is that right?
We did. Yeah. So throughout the Department of Defense Support of Civil Authorities mission, or DISCA, as we call it in the business, less than 1% of people who supported the DISCA response throughout the country ultimately wound up being diagnosed with COVID, and Mercy's numbers reflected that as well. So when we did have COVID positive crew members, of course, we immediately put them into isolation, and we wound up putting them in isolation off the ship. We also conducted a contact interview to see who met the CDC definition of a close contact for our COVID positive sailors. So that definition is less than 6 feet for more than 10 minutes. So we ultimately wound up having more than 120 close contacts that we also put into quarantine. So more than 10% of the whole crew for the mission was in quarantine. Obviously not all at the same time, but a pretty significant number nevertheless. And we also had them in quarantine off of the ship. So that was one of our mitigation strategies to try to prevent further spread of the virus. And in addition to that, we of course closed our gyms, as I think just about every other Navy ship has done, and closed our barbershops. We do social distancing to the maximum extent that you can in the confined space of a ship. And even in our eating areas, we actually spread people out more. So we took away about half the chairs, so people couldn't sit directly across from each other at the tables. And we set up some additional tables under a tent on our flight deck to help people spread out while they were eating, because that was really the one time people weren't wearing their cloth masks, was while they were actively eating their meals. The rest of the time, everybody was walking around in cloth masks, unless, of course, they were engaged in direct patient care, in which case they had an N95 mask and other PPE on.
Okay. And you were getting when you get your PPE and stuff like that, you have to go through the same stream as any of the local hospitals did?
Sort of, but there is a much larger defense logistics pathway that we use to acquire our medical consumables, to include the PPE. But ultimately, the big defense logistics in the sky, if you will, has to go to those same private companies, those private vendors, to get the supplies.
Okay. Now I'm sure we have some scouts out there that are wondering how they can, if they themselves have an interest in going into medicine or going to the service. Do you have any words of advice for those scouts?
Sure. So I'll tackle medicine first. If you're interested, I would definitely try to find one or more physicians who are local to you and shadow them, and really get a sense of what the actual practice of medicine is like. It's not entirely what you see on TV, depending on which show you watch, but I would definitely spend that time with them and just get a real understanding of whether or not you think being a physician is for you. And obviously, there are many different specialties in medicine. So if you really wanted to dig into it, spend some time with people who are doing inpatient work or work in the operating room, as well as people who are seeing a clinic, in an outpatient setting. Get a sense of all the different things that are out there. One, I think that'll help you make a good decision about whether medicine is right for you. And two, ultimately, as you're looking to apply to medical school, the expectation of the medical school admissions committees is that you have done that shadowing and spent that time with physicians to make sure that that medicine is a good choice for you, and that you are a good fit for the practice of medicine. And they'll expect you to have a letter of recommendation from at least one of those physicians, indicating that you interact well with patients, you interact well with the rest of the staff, and so forth. So definitely take that opportunity, get some shadowing, get some mentoring from the physicians as well. For anybody interested in the military, obviously there are many different pathways into the military, and virtually limitless things that you can do. For military medicine in particular, for being a physician, all you need is an acceptance letter from a medical school, and you're all set. You can turn in your application to your local medical recruiter, and they'll be happy to get you set up from there. For those who don't know, the Marines don't have their own medical forces. Those all come from the Navy. So all the physicians, corpsmen, dentists, chaplains, and religious program assistants are all uniform-wearing Navy folks who work with the Marines. And that's because every Marine under the Geneva Convention is a combatant. And of course, all the medical people and chaplains and so forth are non-combatants under the Geneva Convention. So you can't be a Marine and be a non-combatant at the same time. But that was a great opportunity for me as a Navy physician to be able to work with the Marines on a couple of my tours. Tremendous group of people, and I absolutely loved working with them. But yes, to get back to your question, many ways to enter the military. See your local recruiter; they'll be happy to chat. I guarantee it.
That's fantastic. And I just wanted to also follow up. So as I stated earlier, we had worked together at the NOAC. This year's National Aero Conference has been canceled, as well as many summer camps throughout the nation, disappointing a lot of scouts and scouters alike. Any words of advice that you would give to them to sort of get through this difficult period and to look forward to the future?
I'll throw out a few things. One, we use the term social distancing a lot, but that's probably not the right terminology that we should be using. What we're really talking about is physical distancing, not social distancing. So don't sort of let the COVID crisis be the opportunity where people crawl into their shell, and don't socialize, whether it's via Zoom as we're doing or video chat or whatever. You can certainly still plan events. You can conduct training. For example, and if there's something that you need to do as an individual, now is a good time to focus that time and effort on it. Whether it's something you need to read or a project you need to accomplish, take this time when you can't necessarily spend as much time out of doors focusing on those things that do require you to be at a computer screen or be indoors to get through them. So that way, once we are able to congregate outside a little more freely, you'll already have that project or that thing accomplished and behind you.
All right. Well, thank you very much, Captain. I don't have any other questions for you at this time. I really do appreciate you joining us today for our Camporee. I understand you're on leave right now, so enjoy the rest of your leave, and thank you for your service and the service of all the crew of the United States Naval Ship Mercy.
Well, on behalf of the men and women of the U.S.N.S. Mercy, we hope all the scouts and scouters have a great Camporee and keep scouting.
Thank you.